Well, good afternoon and welcome to Voices of Faith Transforming the Community, better known as Saginaw African American Pastors. The mission of SAP, Saginaw African American Pastors, is to be a voice that draws attention, that makes people aware, that allows us to advocate, inform our community about the great things that are going on and ways to help themselves. So what we try to do is we engage in intentional conversations with leaders, and with decision makers at the highest levels. We advocate for changes that will eliminate racism, inequities in our community, and we collaborate with community and faith-based organizations with the whole intent being that we want our community to be better. My name is Dr. Craig Tatum. I serve as pastor for New Life Baptist Ministries, and I have the distinct honor of serving as president for Saginaw African American Pastors. I'm going to be your host on today, and today my host is, my special guest is a defender of health and equality in the person of Dr. Latrice Gordon of the American Cancer Society. And I may not have her title right, but she'll help me with that in just a minute. But again, to the listening audience in Bay City and Midland and Saginaw and even Flint, I always say this, but I really mean it. Here is another superhero in our community, because her real goal is to help us be aware of this very pertinent conversation that we're going to have today, and that is cancer. I'm excited to have her here. I'm excited to have the conversation. So, Dr. Gordon, welcome. We're glad to have you. And let me just start off by saying, I know you work in the cancer space, but tell us a little bit about your current role and what it is that you do.
Okay. Currently, I am a healthcare professional, author, advocate, working in for cancer prevention, education, health equity. I serve as ambassador for Voices for Black Women with American Cancer Society. I also work with the American Cancer Action Network to increase awareness about cancer risks, prevention, screening, and clinical trials, especially opportunities in areas of color. And I also work with the Biden Moonshot Project and National Minority Equality Forum out of DC to help improve cancer care and decrease disparities within the communities of color.
So as you can see, she's got a vast resume of great work in our community and across the country. I'm a little bit interested. What motivates you to work in the area of cancer?
It's a personal story. My father died when I was 21 years old from cancer. So cancer is no stranger to my family. His brother, at the same time, when he died a year later. His oldest brother died, and this is back in the 90s, 1992. He died in 1992. And then the following year, my father, while he was going through his cancer treatment, a different type of cancer, my father developed a lump on his neck, and he didn't want to go get checked out. At the time, I was 19 in the Army, and I was a LPN. So I was, hey, that's not normal. You should go get checked. There might be cancers. But of course, like within our community, fear, I don't want to know. The unknown is better than knowing.
Right.
So he waited a year later, and once he got checked, it was cancerous. He went through chemo and radiation, and he passed away a year later. So that, at that time, I was in my early 20s. And so since then, I've been wanting to make a difference because, cancer took someone dear. And also, I said, it's a strong familiar history. Not only his oldest brother, my dad, he was 9 of them, 7 of them passed away to some form of cancer.
Wow.
And so now it's actually going into the second generation of some of my cousins. 2 of my cousins recently passed away, and it's various different types of cancer. So something has to be done, like the clinical studies, the clinical trials, early detection, early prevention, and education that it's okay to go see someone and to be tested and be screened, because if it's caught early, there is treatment, and it's not always a death sentence as we feel in our community.
A lot of people have similar stories, and I hope they're listening today, and I hope they're paying attention today, in which cancer has greatly impacted their entire family. And what you just shared is phenomenal. I mean, literally cancer with the majority of your father's relatives. So what should people who have a family history of cancer know about their risk and how best prevent it for future generations?
Well, when you go to a doctor, they take a history and physical assessment,
Okay.
and they'll ask you something. They'll ask you about your personal history, and then they'll also ask you about your family history.
Okay.
So talk amongst family, because a lot of times in our community, like we say, what stays in the house doesn't leave the house, but that's not where we need to do. We need to talk about it. So if your aunt had a history of breast cancer, or your grandmother, a lot of times you don't find that out until you're like, hey, mom, I went to the doctor. They say I tested, I might have breast cancer. And they say, oh, well, Aunt Betsy May, she had it. So the next thing is getting that family history down, getting that documentation, know your medical history, and getting those regular health screenings, based on your risk factors. Maintain a healthy lifestyle, eat well, exercise, avoid tobacco. They also found a strong link to alcohol that is a huge cancer risk as well.
Okay.
And just talk to your healthcare provider about biggest thing, genetic testing. A lot of us don't get that genetic testing. Just like Angela Jolie, the superstar, her mother had cancer, so she got tested, had the BRCA gene, and so she took measures to prevent her from getting cancer down the line. So those are just some of the things that you can do. But the main thing is prevention, is getting screened so you can know where your status.
And I think it's very critical and imperative to continue to say to people, it's important that you take charge of your health.
Yes.
I think people have to understand, young, old. We've had several guests on, Dr. Delicia Pruitt. We've had Angela Williams on. We've had Dr. Long on, and several others. And one of the things that we keep trying to emphasize is that the health of Saginaw is ultimately determined by the people of Saginaw. And so we've got to take better care of ourselves. We know in this community, for example, that Saginaw is listed in the top 3 or 4 in terms of obesity in our state. That's not a good mark to have. I'm not happy about that, which says we got to do more. We got to become more active. We got to eat properly. And we know that cancer has a huge issue in the lives of African-American women.
Yes.
So one specific way, I believe, and you can help me with this, that African-American women can get involved in finding cause and ways to prevent cancer is through a new study. And I want you to talk about that. I was just looking at some of the literature on the resource table at our church called The Voices of Black Women. So talk a little bit about that and how women of color can be more engaged in that.
Yes. Okay. Voices of Black Women, like I said earlier, I'm an ambassador. It's a population cohort study, which will help us better understand the demographic, how it's impacted by cancer. This study launched in 2024, and it'll continue until we have enrolled over 100,000 Black women across the U.S. Here in Michigan, we're hoping to enroll at least 3,000 more women.
Okay.
This study is designed to help us better understand the multi-drivers and incidence, mortality, and resilience of cancer and other health conditions among Black women in the United States, so we can better understand and collectively address these issues. Voices will enable American Cancer Society to better partner with the community, community of Black women across the nation, listen to them in meaningful ways. Our voices matter in this here. Meaningful ways to lift up our stories, ultimately better understand how the unique experiences can help us shape a path, engaging and eliminating barriers, and ensure everyone has the same opportunities to be healthy and cancer-free. With this goal to recruit 100,000 Black women, the study will be transformative in helping us learn more about why Black women have some of the highest rates of deaths and the shortest survival rate amongst any racial ethnic group in the United States for most cancer. The recruitment is open to Black women ages 25 to 55 who've never had cancer. For generations, American Cancer Society has conducted some of the world's largest, most impactful population studies in cohorts, better to understand how cancer develops in a population, identify your cancer risks, and learn how to improve both survivorship and outcomes. American Cancer Society population studies have made some of the most, I did that one. So the things looking for, cancer is linked to cigarette smoking, like I spoke before, to cigarette lung cancer, linking obesity to risk of early death, like you spoke about, obesity, and red and processed meats intake has increased risk of colon cancer. So these studies kind of can show what our risks. If you don't know, you don't know how to treat it. And I always say, the faith-based community, pray, but don't delay. So,
Right.
if you get a symptom and something's going on,
I
don't sit
like
home and
that.
get your Bible out and, because prayer is powerful. I'm not taking
It
nothing away
is,
from that.
yes.
But God also gives us other tools. And like I say, pray, but don't delay. So now when you get a symptom, or you go to your doctor and they tell you about, okay, at this age, 40 is the new mammogram, or if you have other risk factors, you do for this test, you do, so a lot of times, like my dad always would say, I don't want to go to the doctor because they're just like a mechanic. As soon as you go in there for your toe hurt. Now they found something else. So, but that's not how it works.
Right.
Something else was already there, and
Right.
it just was discovered when you went in. So these are some very important things to just, that screening piece, and knowing your risk factors, knowing that family history, and then knowing what's appropriate screening for your age, and also that genetic testing.
So you said earlier that you're looking for a group of ladies now that have not been, if I could use a phrase, patients of cancer.
Yes.
And so who's eligible to join the Voices of Black Women study?
Okay.
And what kind of commitment is involved in joining this study? What will it ultimately accomplish? What can they expect as a result of that?
Okay. It ultimately accomplishes, you can join, again, the ages are 25 to 55. Okay, who have never been diagnosed with cancer. This study, you would do a training program. They have this is the all IRB. Everything that's attached to the Voices is already, their literature and already is already set in stone. So there's no deviating for what they developed. So you would go through, there's actual training through the American Cancer Society site. You'll sign confidentiality agreements, and then you go through that formal training. And once you're trained, you can become an ambassador and just educate other women about the importance of being screened, the genetic testing. Because a lot of times, that's one thing that we are kind of not really up on because of the mistrust in the healthcare systems, and also the healthcare systems. The mistrust in healthcare systems.
I got you.
And so when their cancer study comes around, a lot of times we don't want to feel like a guinea pig from the historical treatment with us in the medical community. Yes,
I'm with you.
So, but knowing that the genetic testing can be also a doorway or a pathway to improve treatment for women of color, and also to identify your risk for genetic testing.
Talk a little bit more, because I know and that was startling that you said that women of color have the shortest survival rate when it comes to cancer. What's some of the reasons why?
Okay. So that's why this study is so important.
Okay.
Because they want to get talk with people. And I work in the community, and I come from Flint. And there's an increase, of cancer in the community. And I talk with several people, and there's one person like, well, I was just diagnosed with breast cancer, and it's almost like they contributed to another infectious disease, and they was like, you don't want to tell anybody because it's like you have a marker on you. So that fear and that not speaking about it and not seeking out, appropriate treatment, hiding, a lot of people, sometimes they'll pass away in our community, and you're like, I didn't even know they were sick. I had a classmate, she was 40.
Wow.
And she passed away from breast cancer. She had herself, she lost all her hair, but she had a nice, pretty wig on. You just didn't know. And then she passed away. So that secrecy, that we got to break the silence.
Gotcha.
It's okay to come forward. It's okay to seek treatment. So with this study, it's collectively getting Black women's voices to say, let me tell you about my experience when I went to the doctor, and I call it medical gaslighting. I was telling him about, I had this symptom, and they dismissed it. This is not all physicians, but this is just some people's their perspective. And also, it's true. They go in and they're not being seen. They're not getting a mammogram. You don't read the age. Oh, it's something else, and it's delaying care. So with this study, it's going to stop that delay in care. It's going to get the voices, the experiences of Black women, and take those collectively together to improve our outcomes, improve our treatment of cancer.
So in essence, what again, we hope that everyone's getting the message.
Yes.
And while we're placing emphasis on women of color, cancer runs rampant across every ethnic group. So it doesn't matter. So I want people to make sure they understand that. Those in Bay City and Midland, and again the Flint and Saginaw area, our goal is start taking a look. You said some things I think are very critical. Don't pray and delay. I think that's the phrase you
pray, but
use.
don't delay.
Right.
But you
Pray, but
got it.
don't delay.
Yes.
One of the things that the greatest thing that we can do the minute we see something is not right, we should say something.
Yes.
And we do that for crime. They tell us to do, if you see something, say something. And we should do the same thing. If your body's not acting the way it's been designed, then that's a red flag that something is not right. So going to a doctor, I just passed the men's health certification. And one of the things that, again, became evident is that men in general would take better care of their cars than they'll take of themselves.
Yes, that's
and
so
so that's
true.
a huge indictment on us.
Yes,
And so what we're trying to do now is educate men. Start getting those physicals. Get one every year.
Yes.
You've got to take better care of yourself mentally, physically. And as you do those things, you have a better quality of life. And I think that's what you're saying as well with Voices of Black Women Study. We want you to get engaged so you'll know the signs. You'll be able to encourage other women by being there as an ambassador to help. So where do listeners go who want more information about Voices of Black Women or to see if they're eligible to enroll?
Okay, they would go to voices.cancer.org.
Okay.
And they can check their eligibility at that website. And then you can go into, once you get in there, it'll walk you through, and you'll go through the eligibility criteria. It'll let you know if you're eligible for the study or not. But it's wonderful. Like I say, again, it helps create better guidelines, better treatment, improving our knowledge in our community about what is genetic testing and those things that we don't know about. So it's just knowledge is that power. Knowledge is it's key.
Well, as you think about that, one of the things that I think, and we want to continue to echo with everybody, is we're trying to make sure that our community is a healthier place. And that starts with us individually, making sure that we're healthy, our family's healthy, that we're eating right, all of the above. And the only way to do that is you've got to be more concerned. You can't just allow. I remember I pastored a church in Battle Creek, Michigan for 20 years. And there was an individual there that had some health issues, but he would not go to the doctor. Well, when he finally went to the doctor, it was too late for anything to be done. And so we want to make sure well in advance, like say, the first time we see something, we should say something or do something. So what advice, we're getting ready for a break in just a couple minutes, but what advice would you give ladies that are listening to us right now as it relates to that?
Okay. Well, let's go to the social determinants of health.
Okay.
That's where, you eat, live, work, and play. So a lot of times, like I can't miss my work because I can't afford it to go to the doctor, or I don't have enough money to go to the doctor. So those are some of those things that also influence how you're going to seek out care.
Okay.
So there's different resources. I might not have all of them now, but there's different resources in the community to help you overcome those barriers. I know the American Cancer Society, they do have those resources. If you do have cancer, they also have transportation and breast cancer. I'm also a breast cancer navigator, breast cancer navigators.
Okay.
You can seek out those. So, but the main thing is for screenings, get what you a primary care doctor, someone you can trust, and doctors are like shoes, as they say. If you go to one that don't fit, there you go to one that you are mutual, and take charge of your health care, because don't just put it on the doctor. It's both. It's a two-way street. It's a partnership, because if you go in there and the doctor asks you a question or the screening, are you having bleeding or any nausea and vomiting, and you check no, and then the doctors assume that you don't have this and they don't see it on your physicals. So that way now he's misinformed or she's misinformed, and it's like an investigation. If you don't have the right knowledge or tools, you won't go down the right path. So being truthful when you're going to there about your symptoms, and like speak up, like say if you feel something wrong, especially if you're doing your monthly mammograms, your self checks, if you feel a lump, get into your physician right away. So those are some screenings that you can do. And they're also working on cervical cancer screens that you can do at home. Those kits that instead of going into the physician's office, you can do those. They'll teach you how to do it. You go in the privacy of your own home, you do it, and you bring the kit back. So those are just some simplifying and making screening tools easier.
And I think for us, and I want to talk a little bit more about that on the other side of the
Okay.
break, talking about quality of doctors and make sure you got the right doctor. Want your advice on that. Again, the self-checks. Maybe people aren't doing those. So talk a little bit more about that on the other side of the break.
Okay.
Because there again, we want to make sure we arm all of our listening audience with everything they need to know. Now, if you don't do it, it's nobody's fault but yours.
Right.
But we really want you to be armed, and we want you to be inquisitive. Again, you know, this human body that we have, it is certainly, if I could put my preaching hat on for a second, it is certainly a work of art given to us by God. And sometimes they do go opposite of the way they've been designed, but there are things that we can do to bring them back in line. And so what we're going to do right now, we're going to take a brief break. We'll come back on the other side. I've got a ton of other questions to ask about screenings and all that stuff, but stay tuned. We'll be back. For those of you that are listening, take a minute to like and share. Tell other people we're talking about cancer right now. It's a very important subject. We'll be back in just a couple minutes. Hey, we are back, and again, I am honored to have Dr. Gordon here of the American Cancer Society. She is an ambassador for. Let me go back and make sure I may get it. Is it? Okay, so she's an ambassador. It's for Voices of Black Women. And she is talking to us about a very pertinent issue that we need to know more about, the whole issue of cancer. And on the other side, we were talking about quality of doctors and what does that look like. We were talking about self-check. What does that look like? And I think you said some good things. I think people need to hear it again. If the doctor that you have right now is not meeting your needs, then that means you need to do. I mean, at the end of the day, your health is on the line. So talk a little bit about that for us.
Well, that's just kind of putting you in, giving you your power, putting you in the driver's seat of your health. So not saying that, if everybody's not a good fit. So if you're going to a physician and you're feeling like you're not being heard, you're not being listened to, then if you got a tight shoe, I got to keep walking a couple miles. It just means that this might not be a good fit. Or it's that we talk about that health literacy. That's pretty much what we're talking about right now. So part of health literacy is part of the physician making sure that you understand what is being said and you comprehending the medical knowledge that they're putting down. So basically, if you're talking and they're talking way up here, you just, okay, can you pause? Can you bring that down to, layman's terms? And, you're talking about this, fancy term I don't comprehend. And always would tell people too, when you go in, take someone with you, because I know anytime that you have a diagnosis, health literacy has nothing to do with your educational level. It just has, you go in there and you get some news that knocks your socks off or, that you're not, wasn't anticipating. And that's a heavy word. The C word is heavy, but we're trying to take a lift off of it right now with this voices but when you go in there and you take someone with you, if they need to write down or you need to write down some questions, because a lot of times you're going, I'm going to ask them this, I'm going to say this, and you get there and a lot of times we shrink back and get intimidated because they're the doctor, they're the nurse, they're this, but no, it's a partnership. So if you have questions, write your questions down, sit down with your physician, come up with a plan. That's how it's supposed to be a partnership. He'll tell you, okay, this is your diagnosis. This is a treatment here. And let's work together on a plan that's workable for you to get you to the ultimate health.
And I think people have to understand, number one, you're paying that doctor to keep you healthy. So why would you not go in and share? And there again, it's about getting beyond the stigmas. If the doctor does not work, you've got to take additional measures. And I know with a lot of healthcare networks now, you can't just leave one doctor and go to the next doctor, right? So I get that. But by the same token, that does not mean to settle for where you are. It simply means, okay, I've got to figure out a way. I've got to talk to the doctor and say, hey, is it possible that you can refer me? I'd like to have a second opinion about this. I think those are critical things that we want to make sure people understand. You don't just have to accept this. I think that's very critical for people to know. Now, you talked earlier about self-checks, and there might be young people or adults evolving now with can you talk a little bit about that for us?
Okay. You could do self breast screenings usually monthly on your own. That's at home. Usually like you'll go to your primary care provider and they will, show you an example of how to check your breast monthly to find if you see any type of lumps or anything. And if you notice those, then you report those to your primary care provider.
Gotcha.
Also, they changed, like say, 40s is the new mammogram age. It used to be 50. So unless you have a familiar history, it might be sooner. But getting those yearly screenings, those mammograms, and following up. And also, if you get a mammogram and you get a call back, this is also that's been brought up and to my attention as someone I'm in the community, and they're like, I got a mammogram and I'm so afraid because they called me back. They might have saw something on it. That does not necessarily mean that you have breast cancer.
Okay.
That's that they have to do more investigative work to rule out breast cancer.
Okay.
It might not have been the best type of screen. The mammogram might not caught everything right. So they will refer you back to the radiologist. They might do a different ultrasound. They might do an MRI. So that's not saying that you automatically have cancer if you get a call back for your mammogram. So don't be afraid. Just, go ahead and follow those tests. It's not saying it's not, but it's not saying that you have it, but just some additional steps that you need to take as a preventive measure.
So talk a little bit, Mike, because you're talking about screenings and you just opened that door. What are some screening tests our listeners should be getting for cancer?
Okay. So we got the mammogram for breast cancer.
Okay.
And then also this January was cervical cancer month, which just passed.
Okay.
So cervical cancer is caused by human papillomavirus. And so you get those by a Pap test and then a HPV test, and they can detect cervical cancer early, because cervical cancer can, lead to, ovarian cancer if it metastasizes. So those are some treatable cancers: breast cancer, cervical cancer. And there's also, again, as I spoke about, the blood test for the BRCA gene, that test if you have a familiar history of breast cancer. But just those screenings, when they have routine screenings that go by, I don't have a list of all of them right with me, but goes by age. But I know the mammogram, cervical screening, for your cervical cancer. Those are two things that you follow up with your primary care to do for women.
So, go ahead, keep going.
No, go ahead. I think that's it.
Okay. So we've heard a little bit about the screening piece, but we also understand that screening tests we know they're generally used to find cancer before it shows any signs or symptoms. We get that, but not all cancers have screening tests, correct?
Correct.
So what signs or symptoms should our listeners be aware of that may mean a call to their doctor's warrant?
Okay. So I got a couple more screenings. So we got colorectal screening.
Okay, go ahead.
And then we got lung cancer screenings. We'll go back to breast cancer. So breast cancer, if your nipples are you have leaking fluid, you're not pregnant, or any type of change that they are dimpled or inverted or orange peel or just painful, something's just off about your breast, make sure you go get checked. And definitely if you do those self breast exams, if you feel any type of lump, follow up with your doctor. Those are kind of your first steps, because mammograms are every year. But if you're checking your breast every month, you're more keen to find something abnormal.
Gotcha.
And then for the cancer screenings, they usually begin at 21 years of age and can go up to 65. Those would be done at your gynecologist office, your primary care. Again, that's with your Pap smear. They'll take a test, usually called thin prep or another, and look for the HPV virus, which is most causing cervical cancer. So those are something that you would want to do with your yearly exam. You'll follow up with your primary care. And like I said, colorectal exam usually hits about 50 something. But those, if those exams, and then lung cancer and screenings if you have history like of smoking between 50 and 80.
Mm-hmm.
But to go back to like the cervical cancer, if you have, vaginal pain, bleeding, abnormal bleeding, but sometimes those are silent. If you don't get those tests, you won't even know that you have them.
So having looked at those, and it just kind of takes me, full circle to come back to how we started out when we talk about the American Cancer Society, and what it does to make sure that, we as a people, and I mean just people in general, are in the know. I do know that, just recently they released 2025 cancer facts and figures,
Yes.
in which they noted, which you talked a little bit about earlier, that people of color are twice as likely to die as white people from largely preventable cancers. So why do you think, or what does the information suggest as why these disparities exist?
That's what we're looking for the study, but most of it goes back to screening,
Okay.
access, those health disparities. So if you don't have the access to the proper screenings, if you don't have the access to the doctor, we will go back to those social determinants of health.
Okay.
If you can't afford to go to the doctor, insurance problems, childcare problems, those are some of the things that can cause you to delay
Gotcha.
your treatment or not being sought out. And also, again, like I say, going into the medical system, if you're not heard, they also have this is like cancer, but they have like the Hear Her campaign with the mortality with childbirth.
Okay.
So if you're not heard in that gaslighting, so if you go in and you say you have this symptom and it's overlooked or not checked, and so they're trying to do this study to find out, to hear from us those experiences that we have, and they can take that information and to build upon it and create more guidelines, preventative treatments, screening guide times.
And so again, the premise for everyone listening is there is a way that you can make your experience matter.
Yes.
And it's through, again, this ambassadors program that's out there. It is so valuable, young or old. Your information could transform, could help, could save lives.
Yes.
I think I need to say it from that standpoint. So beyond prevention, when you or someone you love is diagnosed with cancer, what are some things, or what things should they keep in mind? What steps should they take should they find out they have it?
Okay. That's when you're going to come back with your primary care doctor. You're going to have that team. You're going to make sure you follow up, create that treatment plan. Also, again, we talk about the things that you can't modify. You can modify your diet, decrease that stress.
Okay.
Exercise, and just follow up that plan that's going to, there's going to have a set plan for you. It might look like surgery. It might look like chemotherapy. It might look like radiation. It might be palliative. That means that there's nothing that really can be done except there's comfort measures. So it's all depending on what staging that you're in and what that physician, radiologist, and oncologist come together and decide.
And so again, one of the things I want to make sure, and you highlighted earlier, just because you find out you may have cancer does not mean that you're going to die from cancer.
Correct.
Okay.
And if we have those stories, like I say, the person I talked to, she said, well, I've talked to a lady at my church, and I finally told her, she said, oh, I had cancer 20 years ago. Or, so if we know more, come out that hiding spot or not, well, I'm not going to tell anybody. I don't want anybody to know my business because, it's scary. But your testimony of how you survive can help someone else to know that it's not, I'm not saying say my dad, he passed away, but, I'm not saying everyone passes away.
Right.
So there is, there's a lot of improvement over 20 years. And he told me, he said, after I pass away, he always told me there's going to be a cure from cancer. So that I still hold on to those words to this day that he said. So until then, we're going to fight and get everybody the equal opportunity, equity, into having those studies, having those testings. We go out, like I say, with National Minority Quality Forum and do screenings in the neighborhood.
Okay.
We come, and come to the neighborhoods. We come to where people are. So we go to the churches and we'll provide mammogram buses, and then we'll have the colorectal people out. They'll have Cologuard screenings, like giving me
excellent.
So different screening tools, and also they'll teach how to do your breast cancer breast cancer exams, your monthly breast exams. So those are some of the things that we're doing. Is going on in the community. American Cancer Society also partners to do that. Bring that information in the community. Bring those to the church fairs. Just like we pass out the Voices flyers, but get that information out there where it's tangible. Well, I don't have to drive 20 miles to get this resource. It's right here in my community.
Right.
At this church, they're offering this.
So you open a door there. So I want to ask, for any church that's listening, what are ways that we can get access to some of those services? Because I think it's real critical, particularly in the African-American community. What are some ways we can get you guys to show up and help us help our people?
Okay. Well, like I stated, like the National Minority Equality Forum, that's one of the big people out of DC, the American Cancer Society, and then also partner with the local health department and some of these local hospitals. So what we did in Flint, we got all 3 hospitals. It's Henry Ford, Hurley Medical Center, and McLaren, and each one of them brought some type of service to the community.
Excellent.
And, if it was one was doing breast cancer and one was doing this. So it takes a community.
I understand.
So, it's like, the village to raise a child takes a community to raise a community. So getting those community partners, those different stakeholders involved in it, it just takes an axe.
So, as we get ready to wrap up here in just a couple minutes, I know one area you support is introducing people of color to clinical trial opportunities.
Yes.
So how do people learn about explain what that means, number one, and how do they learn more about clinical trials, and when does it make sense to consider joining a trial clinic? Okay.
I'm actually going to be joining. I'm not saying myself. Through Michigan, University of Michigan, they have one with the breast cancer bus they have.
Okay.
And so with this study, it's going to connect you to, I don't have this name, with a genetic counselor and genetic testing. So when you go through and you do a risk assessment, and this risk assessment will determine if you're at a high risk for cancer.
Okay.
Like I say, with that strong family history, increased risk for cancer, or this. So once you do that, it'll take you and look at your genetics. And like I say, that Angela Jolie, she's not a woman of color, but she did the genetic testing because her mother had cancer. She found out that she carried the breast cancer gene, and then she went proactive to take care of measures that she wouldn't, have cancer. So what it is, those different companies will come out, or American Cancer Society, or anybody that's doing the genetic testing, first of all, should introduce themselves to the community, have a conversation, like, okay, what do you know about genetic testing? And then and then explain exactly what this genetic testing involves. And that way, building the trust, getting that trust together. Because, a lot of times I say you go back, they're like, what you going to do with my information? I'm not getting that genetic trial. They're going to clone me, So, just, put a little humor to it.
I believe that's out there.
But just that misinformation. And so now, if we don't have the clinical trials to know how to treat us as people of color, then the medication might not be as effective. So by getting those clinical trials, they can study, all right, we tried this, and this is more effective for women of color.
Gotcha.
Yeah.
I think this is all great information. I cannot underscore the necessity of it for ladies in our community on every ethnic group. We know that there's a huge issue with women of color, as with African-American men. We know that they don't take good care of themselves, but we can do better. And this is one where, again, we can make a decision now. I'm going to file through. If you've had people, and I hope people heard this, if there are people in your family, extended members that had cancer, you may want to go and just get checked out. It could be genetic. Sometimes, you've heard people say, well, it skips one generation and goes to the next. I mean, all of those are things that can happen. But you got to be curious enough. I'll say it like this: what do you have to lose?
Right. Exactly.
I mean, and the answer is you have your life to lose.
Correct.
All right. So take the time, go to the doctor, ask questions, become curious. And then here's the other piece. And this is not just for women, but for brothers as well. We've got to do a better job of taking care of ourselves. We've got to eat better, rest better, all of the above. And those are things that we hope the listening audience is taking note of.
Yes. And men can get breast cancer as well.
Yes, ma'am.
Yeah. So that's in the study that's going on is Dr. Pleasant. She is from what is it, University of Michigan. And she
Okay.
has a mammogram bus, and it's in Flint right now. But I can give you the information to connect you with her, and maybe we can get that and the genetic testing, and it's all free, because you have genetic testing. Sometimes if you go to your insurance company, it could be anywhere from $200 to $300 if they don't deem you necessary to have it, because I just want to know. But if you have a strong history and they, do a risk assessment and you qualify, it should be covered by your insurance.
And notice now, again, you said it's free. And let me come back and co-sign. I had one of the ministers at our church. He passed away. It's been almost a year now, maybe a little bit longer. But he, at one point in his early life, had breast cancer as a male.
Yeah.
So I clearly understand that he had some other health complications from which he passed away. But that was really the first time that I had been exposed to an individual, a male in particular, that had gone through cancer. So we've got just a couple minutes left. So I want to pause and have you give us some concluding remarks about this whole issue we've been talking about today.
Okay. Again, go to voices.cancer.org if you want to enroll in Voices for Black Women. You'll do a training. Once you get there, it'll walk you all the way through there, give you all the literature to help you become an ambassador in your community. We need everyone's voices. Our voices matter. One voice, two voices, like I say, one to put 1,000 flight, two will put 10,000 flight. So we need everybody to join in on this so we can help improve our outcomes. We can stop this. We can make a change. And that's the whole thing here. What my passion about is making a change. If I can help someone not lose their mom, not lose their father, or, by education, if we can get them that health literacy piece and understanding, if you get screened early, you can start your treatment early and have a better outcome. So those are some of the takeaway things that I have for Voices. And also, like I said, screening.
Okay.
Yes.
Well, listen, we're out of time.
Yes,
and so I want to pause and thank you, Dr. Gordon, again, of the American Cancer Society, for being with us on today. You shared a treasure trove of information that I believe is going to help people in our community. Let me thank Alpha Media Kiss 107 again for this platform. Let me thank again our trusty engineer, Mr. Matthew Lester, who does a stellar job week in and week out, keeping us on point and helping us move forward. New Life Baptist Ministries, let me thank you. And again, Saginaw African American pastors, thank you for this opportunity. A couple of things to think about as we get ready to close. I just picked up two quotes I think are applicable to what we're saying. Here's one. I'm not defined by my cancer. I am stronger than it. That's one. So if you have it, cancer does not define you. You are stronger than your cancer. And then here's the other piece. If you have it, here's another quote I ran across. I will fight this with everything I have. I am a warrior. So Saginaw, it's really up to us as residents to ensure that we take better care of ourselves. And that starts by eating right, encouraging each other to go to the hospital, ask the questions. Don't leave without getting your questions answered. You gave some good information. Write them down. Take somebody with you. It starts in the home. It then trickles to our neighborhood and into our society. So it's up to us. If we want a better community, we've got to collectively work together. So, hey, that's my prayer. Until we meet again next time, God bless you. That is our prayer.